Assalamualaikum and hi. I am Darushiman and I am from Group 6. Today, our group will be presenting about Trichotillomania. Before we begin our presentation, let me introduce my group members. Our group will be consisting of me, Darushiman, Muhammad Irfan, Akil Darwish, Edina Humaira, and Ariana Christina. Now, let's start with the history.
For the history of trichotillomania, it was derived from the Greek words for hair, to pull, and madness. Although this term was conceived in 1889 by the French dermatologist Francois Henri Leopold, the practice of hair pulling has been discussed far back in history. Hair pulling was first mentioned by Aristotle in the 4th century BC. Although the act of hair pulling is currently attributed to a psychiatric disorder, historically it has been described both as a punishment and as a somewhat violent expression of one's own disillusionment, frustration, and disappointment.
Now I'm going to talk about the symptoms of trichotillomania. So the first one is the patient who is repeatedly pulling hair, and the size for them to occur might vary from time to time. So the second one is increasing sense of tension before pulling the hair or after pulling the hair and resisting to pull the hair. So the third one is they feel pleasure and get like relief after hair being pulled. So the fourth one is noticeable hair loss, since they tend to pull their hair when they are under stress. So they will pull their hair and this will create noticeable hair loss. For the fifth one is they might bite, chew, or even eat the pull out hair. Sixth one, the last one is playing. They will play with pulled out hair.
Next, we'll move on to the prevalence in cases of trichotillomania. Prevalence studies suggest that trichotillomania is a common disorder, which is the point prevalence estimates of 0.5% to 2%. About 5 to 10 million people in the United States, which is roughly 3.5% of the population, meets the clinical criteria for trichotillomania. Trichotillomania usually develops just before or during the early teens, most often between the ages of 10 and 13 years. Infants can also be prone to hair pulling, but this is usually mild and goes away on its own without treatment. Although trichotillomania involves pulling out body hair, there are two types, which are automatic and focused pulling. In automatic hair pulling, the individual may not even realize she is doing it until after the fact. For example, she could be zoning out, watching TV, then look down and realize that the couch is full of the hair that she pulled. In focused hair pulling, it is done very intentionally because it feels good. Often, focused hair pullers will wait until they are in private to engage in the behavior.
So next, moving on to our case study of trichotillomania disorder. So there was a 17-year-old boy, AG, who was referred to the dermatology department at Shelby Hospital in India with complaints of increasing bald patches in the scalp region. The dermatologist advised him to go for an ultrasound of scalp, but there was no organic cause of baldness that was found. However, it came to notice that AG had been pulling off his hair. With immediate effect, he was referred to the psychiatry department at Shelby Hospitals. Assessment was done by a psychiatrist and a psychologist, CBT, cognitive behavioral therapy specialist. Hemogram, renal and liver function tests were done and were normal. USG was done to rule out trichophagia, which is hair ingestion. AG was eventually diagnosed with trichotillomania. His mood was athymic and he acknowledged hair pulling as a problem that he wanted to get out of. Insight and self-care were good, but over time, TTM, trans-theoretical model, had resulted into depression. On a case of severity, AG hair pulling fell between moderate to severe. Although the patient was not ingesting hair, he used to compulsively pull hair, which had resulted in baldness of almost 1/3 of his scalp. The consequent guilt he experienced made him feel depressed, unfocused on studies, and perform poorly in academics. The problem of hair pulling, as reported by the patient, had started first 2 years back when he had noticed his mother plucking her brows and with tweezers at home. Upon asking his mother, she had told him that unkempt growth of hair made one look unattractive. Thus, it was a must to keep her trim and short. This had somehow reinforced the belief in him that his scalp and brow hair had needed trimming and he needed to do it by pulling it. Further assessment by the psychiatrist and the psychologist revealed that high level of tension and discomfort which led him to pull hair. Pulling hair resulted into instant gratification which lasted for a short duration, and this will again give rise to the feeling of discomfort. Thus, a vicious cycle of hair pulling and low mood have been formed.
For treatments, NICE, National Institute for Clinical Excellence guidelines propose that CBT, cognitive behavior therapy with HRT, habit reversal therapy, alongside pharmacotherapy. Pharmacotherapy commenced with fluoxetine SSRI at 20 mg per day, clomipramine tricyclic antidepressant at 75 mg, and non-sedating anti-anxiety medicine etizolam, benzodiazepine at 0.5 mg at night were started as primary treatment. Vitamins, minerals, and keratin protein medicines were prescribed by the dermatologist to aid in rapid regrowth of hair. As the improvement in parameters of depression, sleep, appetite, and concentration in studies was noticed, the psychiatrist, seeing the positive response, titrated the dose to optimal, fluoxetine 40 mg per day in divided doses, clomipramide 150 mg per day in divided doses, and etizolam was continued at the same dose. AZ was asked to start regular psychotherapy sessions along with medicines. Next, cognitive behavior therapy, CBT. It helps to identify and examine distorted beliefs that are related to hair pulling, and habit reversal therapy, HRT, which is a primary treatment to learn how to recognize the situations where it will happen and substitute for other behavior instead. The variant of this technique, decoupling, involves quickly redirecting the direction of your hand. Approaches to create awareness for this disorder is first social media, sharing information on popular social media platforms such as Instagram, TikTok, and YouTube to raise awareness of the disorder's effects and how prevalent it is. Next, campaigns. It is to reduce stigma associated with mental illness, promote help-seeking behaviors, individual education, and outreach events by organizing campaigns. And lastly, talks. Give support, let them know that they are not alone, and improve the quality of life for people affected by these conditions by holding talks at schools and institutions about the disorder.
That's all from us. Thank you.